Secondly, between the adhesive and the adherent, the bonding agent should flow very well onto the surface of the substrate. The substrate that we are supposed to bond should have a high surface energy, and the bonding agent that we place should flow very well. That means there should be low contact angle between your adhesive and substrate. Okay, these are the two fundamental requirements. So we have to condition the tooth structure so that the surface energy of the substrate is increased and there is a good contact between the bonding agent and the substrate. So let us see how these fundamental requirements are made in the clinical situation. The first substrate to be bonded in the clinical situation is enamel. So we talk about enamel bonding first. There are two steps involved in bonding restorative resins with the enamel. The first step is acid etching. We have to condition the tooth surface to increase its surface energy, isn't it? We have seen the fundamental requirement is the substrate to be bonded should have a high surface energy. So it is done by acid etching. And second step is application of DBA. Dentine bonding agent is the term that we generally used, but these are the agents which are used both for enamel as well as dentine. So simply we can say application of the bonding agent or the adhesive. Okay, this is the adhesive bonding agent. So let us first talk about acid etching of enamel. Acid etching of enamel, it was introduced by Michael Buonocore. Okay, Michael Buonocore in the year 1955, and he initially used 85% inorganic acid, that is orthophosphoric acid. H3PO4 stands for orthophosphoric acid. It is a strong inorganic acid. Initially he used a high concentration of 85%. But what is the recommended concentration? The currently recommended concentration of the acid is 37 to 50% of orthophosphoric acid. A strong inorganic acid is used for acid etching. Okay, so this is the recommended concentration. And how much time it is applied to the enamel? The time of application recommended is generally in the range of 10 to 15 seconds. It is a generally accepted time for acid etching of enamel, and always remember that longer duration of application of acid to the enamel does not increase the bond strength. Okay, simply more demineralization would occur and the bond strength would not improve, which is undesirable. So the standard time of application is 10 to 15 seconds on the enamel. Whenever such concentrated orthophosphoric acid is applied to the enamel, there is increase in surface energy of enamel. This is a desirable outcome. We have already seen it is one of the fundamental requirements. It also increases surface area of enamel for bonding. It also increases the surface area of enamel available for bonding. And how much? It is nearly 2000 times increase in the surface area of enamel. A huge increase in the surface area occurs. So both of these are situations that favor the bonding to enamel. Whenever we apply acid to the enamel, there are three patterns of etching. What is meant by patterns? Patterns means the microscopic appearance of the substrate after application of acid to the substrate. So there are three patterns of etching depending upon the mode of dissolution. The type 1 pattern of etching. Okay, all of you know that the enamel consists of enamel rods which are keyhole in shape in the cross section. These are the enamel rods in cross section, keyhole in shape. This is the head of rod, this is the tail of rod. So whenever we apply acid to the enamel, type 1 pattern results when there is selective dissolution of rod head centers. Rod head centers cores. There is more dissolution of the center of the rod head. Mean the acid would act more on the center of the rod head. They would dissolve more as compared to the periphery, and that results in microscopic pattern that is called type 1 pattern. This type 1 pattern is also called honeycomb pattern. This is also called honeycomb pattern. Then type 2 pattern is another microscopic appearance that happens when we apply acid to the enamel. And this type 2 pattern results due to selective dissolution of enamel rod periphery. Means there is more dissolution of the periphery as compared to the center of the rod heads. So if this is a rod, enamel rod, the periphery is dissolved more, and it results in a microscopic pattern which is called type 2 pattern, sometimes also called cobblestone pattern. Cobblestone pattern. So principally two patterns are there, honeycomb and the cobblestone pattern, type 1 and type 2, and thirdly there is a type 3 pattern which is a mixed inconspicuous pattern. Inconspicuous means there would be certain areas of type 1 dissolution, there would be another areas of type 2 dissolution, so it is a mixed inconspicuous pattern. So whenever we see an etched surface of enamel under the microscope, we can realize and see three different morphological patterns which are called type 1 or the honeycomb pattern, type 2 or the cobblestone pattern, and type 3 is a mixed inconspicuous pattern. And the most important thing about is this, that these patterns of etching do not influence the bond strength. So we can say that etching pattern has got no influence on the bond strength. Bond strength of the restorative resins is not influenced by the type of etching pattern that happens, and this is also a advantageous thing because we do not have any control on the type of pattern that would happen. It simply depends upon the enamel surface topography. Next thing about acid etching is that it produces microporosity. Whenever we apply a strong acid, that is 37 to 50% orthophosphoric acid for 10 to 15 seconds, there is microporosity of the surface which is 10 to 20 micron deep. This can also be said as depth of enamel demineralization. This is depth of enamel demineralization due to acid application, 10 to 20 microns. Okay. Subsequently, in this microporosity, we would be adding in the second step a dentine bonding agent. So there is a surface microporosity. The enamel surface develops depressions or microporosities which are 10 to 20 microns deep. Okay, and subsequently there would be infiltration of a bonding resin into these microporosities that forms the enamel and the resin bond. It results the enamel resin bond. This junction of bonding agent with the microporosities of enamel, it is called hybrid layer. Hybrid layer. Hybrid means two type of substrates are there. One is your bonding agent which penetrates into the microporosities created into the enamel surface due to acid application. So this is known as hybrid layer. It is about 0.5 to 2 microns deep. Hybrid layer. Okay, so the resin would infiltrate the etched enamel surface. What resin? The bonding agent that we would use in the second step. It would penetrate deeper. So there are two types of resin tags. So resin would penetrate and it would form tag inside the etched enamel surface. One is a micro tag, another is a macro tag. Micro and the macro tags. Micro tags, they form at the end of enamel rod. We all know that enamel rod has a keyhole type structure. So the tags of resin that would form at the end of enamel rod are called micro tags. Similarly, macro tags, they form between adjacent enamel rods. They form between adjacent enamel rods. Micro and the macro tags. What does it mean? We have etched the surface of enamel with the application of a strong orthophosphoric acid for 10 to 15 seconds. The surface becomes microporous. The surface area increases to nearly 2000 times. And because the enamel is consisting of structures called enamel microtags and macrotags, sorry, for the interruption. Okay, so they contribute to the bond strength of enamel, and microtags, they are more important for bond strength. So microtags are more important for the bond strength. This is about acid etching of enamel. The second substrate that we use for bonding in majority of the clinical situations is dentine. Definitely, we make different types of tooth preparations, class 1 through class 5, which may involve significant amount of enamel and dentine or both. Okay, so dentine, if we talk about the acid etching of dentine, then we use the same 37% to 50% orthophosphoric acid. The same etching agent is used, and the time of application is also the same, that is roughly 10 to 15 seconds. No change in the agent in the duration of application. We all know that dentine is a substrate which is less mineralized as compared to enamel. So if we talk about depth of demineralization, then definitely, because the mineral content of dentine is less, the depth of demineralization is only 7.5 microns with the same acid and the same concentration applied for the same time as compared to dentine. Dentine is more mineralized, so application of acid would remove more of mineral from enamel as compared to dentine, so there is a difference in the depth of demineralization. We can say it is the depth of resin tags. So the amount of resin tags and the depth would be less in dentine as compared to enamel. And the second phenomena which happens due to acid application is that acid application decreases the surface energy of dentine. This is a very important difference between the acid etching of enamel and dentine. We have seen initially that one of the most important requirements for a successful bonding is that the substrate that needs to be bonded should have a high surface energy, but acid application to the dentine decreases its surface energy. Why? Because due to exposure of collagen. We all know that collagen is the principal organic content of the dentine. So whenever demineralization is there, the organic collagen is exposed to the surface, which leads in decreased surface energy. And this makes an acid etched dentine a difficult substrate to bond as compared to enamel. So these are the two differences which happens in the acid etching of enamel with respect to dentine. Okay. Then the second step is application of dentine bonding agent. We can simply call it bonding agent because it is used for enamel and dentine both. Okay. So what are principally bonding agents? They were first introduced in the year 1951 by Oskar Hager. Oskar Hager first introduced dentine bonding agents. Okay. Technically, dentine bonding agents have a chemistry MRX molecule. Chemically, they are molecules like this, can be represented as MRX. Okay, where R is the hydrocarbon spacer. Okay, M is the hydrophobic end. It is a bifunctional molecule, hydrophobic end, and X is the hydrophilic end. So basically bonding agents are bifunctional molecules, isn't it? On one side we have got tooth, on the other side we have got resins. These are two technically different agents that we have to bond together. So we need a bifunctional bonding agent which consists of both hydrophobic and hydrophilic ends. This hydrophilic end, it would bond with the tooth structure because the tooth substrate is hydrophilic due to presence of hydroxyapatite, and the hydrophobic end would bond with the resin or the composite, we can say. So this is actually the bonding interface. This is the tooth substrate. Okay, this is the bonding agent and this is the composite, and this one is bonding agent. This is how fundamentally the bonding occurs between the tooth and the composite. Tooth is hydrophilic and the composites are hydrophobic. So we need bifunctional molecules. Now we talk about development of bonding agents. BA stands for bonding agents. During the course of development, the bonding agents have been traditionally divided into generations. So we would follow the same concept and study the different generations of bonding agents. The first generation products of bonding agents, they were chemically based on surface active comonomer. They were based on surface active comonomer, that is NPG-GMA. The full form is not required for you, but if you want, you can note down that NPG stands for N-phenylglycine. GMA is glycidyl methacrylate. It is a chemical compound, resin-based chemical, that is the basis for the first generation of bonding agents. What was the mechanism of bonding? How did the bond with the tooth structure? It was simple chelation of calcium ions of smear layer. Chelation of the calcium ions of the smear layer. What is a smear layer? All of you must be knowing that whenever we cut the dental hard tissues like enamel and dentine, there is generation of a microscopic altered layer on the surface that is called smear layer. So suppose this is the tooth structure. Whenever it is prepared, there is generation of a smear layer onto the surface, and this smear layer definitely consists of altered hydroxyapatite, means calcium ions are present in the smear layer. This calcium ions of the smear layer, they are chelated with NPG-GMA based bonding agents. This is the basic mechanism of bonding of the first generation compounds based on NPG-GMA. Chelation of the calcium ions, but remember that these calcium ions were not of the tooth substrate, but they were of the smear layer present on the tooth. Whenever we prepare the tooth structure, there is generation of a microscopic smear layer. This smear layer is bonded with tooth with a shear bond strength of 6 megapascals. The bond strength between the tooth substrate and the smear layer is 6 megapascals. The bond strength between tooth and first generation dentine bonding agent is only in the range of 1 to 3 megapascals. You can see a very weak chelation occurs between the NPG-GMA based first generation bonding agents and the calcium ions of the smear layer. Critical bond strength critical or the minimum bond strength for successful in vivo retention means to retain a bonded restorative material inside the oral cavity, we require at least a bond strength of 10 megapascal. This is the critical bond strength for successful in vivo retention. You can see that the first generation of bonding agents were far below this critical bond strength and achieved the bond strength of only 1 to 3 megapascals. Example of a first generation product is Servident. Okay. Then in the course of development came the second generation of dentine bonding agents. Second generation, they were chemically different. They were chemically based on phosphate ester materials. They were chemically based on what? Phosphate ester materials. So they consisted of negatively charged phosphate ions, and the mechanism of bonding was different than from the first generation. It was ionic bonding, a stronger bond as compared to chelation, with calcium ions of again the smear layer, because whenever we would cut the tooth substrate there would be generation of smear layer on the surface. So what happens, this is the cut tooth substrate. It would consist of a smear layer bonded to it with a bond force of 6 megapascals, consisting of calcium ions in it, and these calcium ions would be ionically bonded with the negatively charged phosphate ester materials. Mechanism of bonding. Since the bonding was ionic as compared to the chelation reaction of the first generation, the bond strength obtained was slightly better in the range of 2 to 5 megapascals, but you can see still it was far below the critical bond strength requirement of 10 megapascals. So these bonding agents were also not clinically very successful. Example is a Scotch bond. Scotch bond, second generation bonding agent. Then came the third generation. In the third generation bonding agents, they were chemically same as second generation. Means there was no change in the chemical composition of bonding agents. They were also phosphate ester materials. They were also phosphate ester materials. But what was the change? There was partial dissolution of smear layer. Partial dissolution of the smear layer generated on the tooth surface by weak acids like 20% maleic acid. Instead of the currently used strong inorganic acid like 37 to 50% orthophosphoric acid, in the third generation systems there was a concept of partial dissolution of the smear layer by weak acids like maleic acid. So what happened? This is the tooth structure. Due to acid application, there was partial dissolution of the smear layer. Smear layer was removed from certain areas of the prepared tooth. This smear layer consisted of calcium ions. Then there was calcium ion available from the tooth hydroxyapatite. Calcium ions of the tooth hydroxyapatite. Calcium ions of the smear layer. Calcium ions of the smear layer. These positively charged calcium ions of both the tooth and the smear layer were again ionically bonded with the negatively charged phosphate ester materials, because technically they are the same as second generation, only an additional step of partial dissolution of smear layer is there with application of a weak acid like 10 to 20% maleic acid. So we know that hydroxyapatite calcium ions is strongly bonded with the tooth structure. So with the third generation, the bond strength was first time more than the critical value of 10 megapascal. They were the first clinically successful bonding agents, third generation, which involved an additional step of partial dissolution of the smear layer by application of weak acid. Example is Scotch bond 2. Suffix 2 is there. Simply Scotch bond is second generation, Scotch bond 2 is third generation. It is the first ADA accepted dentine bonding agent. So first, second and third, they are the initial generations of the bonding agents. Then came the fourth generation. Fourth generation were based on an entirely new concept, that is total etch concept. Total etch. As the name indicates, total etch, there was complete removal of smear layer. Complete removal of the smear layer by strong inorganic acid, that is the currently used 37 to 50% orthophosphoric acid. Instead of malic acid, when we apply strong acid, there is complete removal of the smear layer. That's why these are called total etch systems. They completely remove the smear layer. And when the smear layer is completely removed, the calcium ions available for bonding are entirely of the tooth substrate, so they would produce the strongest bond. Fourth generation, they are considered to be the gold standard bonding agents. Which generation? The fourth generation total etch. They are represented as steps of etching plus priming plus bonding. This is the technical representation of fourth generation of bonding agents. First step, we apply the etchant. Second step, we apply the primer. Primer is nothing but the hydrophilic component of the bonding agent. And the third step, we apply the bonding adhesive. Okay. So depending upon the steps involved, these fourth generation of bonding agents are known by different names as two-step total etch, three-step total etch, three-step total etch, or three-step etch and rinse bonding agents. Okay, three-step, we have seen technically there are three steps involved. One is etching, which is also called conditioning of the tooth surface, then the primer application, then the bonding agent application. So three-step total etch or three-step etch and rinse bonding agents. And remember, they have got the strongest bond strength amongst all the different available generations and considered to be the gold standard. An example of a fourth generation is Scotch-Bond multipurpose. Scotch-Bond multipurpose. Okay, fourth generation. So if we talk about the advantages of these fourth generation systems, which were three-step etch and rinse systems, firstly, we have seen there is increased bond strength. Second advantage is removal of smear layer on enamel. When the complete removal of smear layer happens from the enamel, the entire enamel substrate is available with its calcium ions of the hydroxyapatite to form a strong bond with the bonding agent, isn't it? But if we talk about the disadvantages of these total etch systems are all related to dentine. You have to remember like this, that advantages are all related to enamel and disadvantages are related to dentine for the total etch systems. Why? Because we know that dentine has a structure like this, which consists of dentinal tubules. Whenever we cut dentine, there is generation of smear layer, isn't it? Like enamel, there would be generation of smear layer on dentine as well as there would be formation of smear plugs that occlude the dentinal tubules. These are smear plugs. This is smear layer. Now when we apply a strong acid like 37% orthophosphoric acid, it results in total etching, means there is complete removal of the smear layer. So it would remove the smear layer as well as the smear plugs. it would result in open dentinal tubules. And what would happen due to open dentinal tubules? There would be increased incidence of dentinal hypersensitivity. If I am using a total H bonding agent on a tooth preparation which consists majorly of dentine, then I would be promoting dentinal hypersensitivity, because a strong acid like orthophosphoric acid would completely remove the smear layer and smear plugs, open up the dentinal tubules, which would result in fluid movement and hypersensitivity. So one disadvantage is that there is increased incidence of dentinal hypersensitivity with total H systems. The second disadvantage is also related to dentine. We know that dentine, when acid is applied to dentine, what happens? Its surface energy decreases due to exposure of collagen. The mineral would be lost and the collagen would be exposed to the surface. So acid etching, it exposes collagen. So this is the network of collagen that is exposed due to acid etching of dentine. Now, before applying the second step, that is the primer application, we all know that we have to air dry the surface after acid etching, isn't it? Whether it is enamel or dentine, after removal of the acid, we air dry the substrate. This air dry causes collagen shrinkage. This is the collagen network exposed due to acid etching. The second step of air drying causes collagen shrinkage, which is up to 2/3 by volume. A massive shrinkage occurs happens in the collagen network. Now when these collagen fibrils would shrink and we apply the primer and the bonding resin, they would penetrate with difficulty into the shrinked network. This shrinkage causes difficult penetration of resin. What is resin? Your primer plus bonding agent, isn't it? They are flowable resins, and the collagen network has shrinked, and if there is difficult penetration, there would be poor bonding. So these are the two principal disadvantages of total H systems, all related to dentine. Advantages are all related to enamel. In enamel there are no dentinal tubules, so complete removal of the smear layer would not cause any hypersensitivity. Also, because there is no collagen or very little collagen in enamel, the air drying would not result in any significant shrinkage of the substrate, so the resin penetrates very well as compared to dentine. Okay, then comes the fifth generation. These fifth generation products are also total H systems, but they are two-step total H, or they are called two-step etch and rinse. Two-step etch and rinse, and represented as etchant plus primer and bonding resin are present in the same. So the steps are simplified from 3, it has become 2. What is the etchant? Same 37% orthophosphoric acid or the conditioner is used. Okay, only the steps are simplified. So the advantages and disadvantages of the fifth generation remain the same as that of the fourth generation. Advantages are all related to the enamel that we have discussed, and disadvantages are all related to dentine that we have discussed. Example of this is prime and bond, fifth generation, prime and bond NT, fifth generation bonding agent. It is called two-step etch and rinse. It is important that you remember the proper terminology. At times they even show you diagrams. Diagrams means instead of an etchant, they may show you a syringe of acid, and they may show you primer and the bonding agent both in the same. So you have to identify the generation of the bonding agent. What is the generation? You can identify that it is a 5th generation. Now you can see both the primer and the bonding resins, they are present in a single component. So they are also called single bottle adhesives. Single bottle adhesives. Whatever bonding resins are there are present in the single bottle along with the primer, so they are also called single bottle adhesives. What are single bottle adhesives? They are the 5th generation of dentine bonding agents. See, etchant is not the part of adhesive. Etchant is simply used to create the microporosity, increase the surface energy, and increase the surface area. The bonding resins consist of the primer and the bonding agent, and since they are present in a single bottle, the name single bottle adhesives is also used for the 2-step etch and rinse system, which are the 5th generation. Then comes the 6th generation. Sixth generation, they introduced the concept of self-etch systems, and they were the 2-step self-etch systems. 2-step self-etch. Self-etch, as the name indicates, they are also called self-etching primers. Okay, they are also called, SEP is the abbreviation used for them. They are also called non-rinsing conditioners, or NRC, non-rinsing conditioners. How do we technically represent such systems? They would be consisting of self-etching primers. A primer which consists of acidic monomers plus a bonding resin. So you can see technically they are different from the 5th generation because they are the self-etching primers plus the bonding resin. So they are also called 2-step self-etch systems. Okay. Based on pH, they can be mild, moderate, or aggressive. These 6th generation systems, based upon the pH of their acidic primers, they can be mild. pH is in the range of greater than 2. When the pH is in the range of 1 to 2, they are moderate, and the pH is less than 1, they are aggressive. So 3 different categories of these 2-step self-etching systems or the non-rinsing conditioners are present, which are the 6th generation self-etch products as mild, moderate, and aggressive. Now you can see we are not using a separate etchant for them. We are not applying orthophosphoric acid. So what happens? They do not remove smear layer. These self-etching systems would not remove the smear layer. This is the most fundamental difference between the total etch and the self-etch systems. The total etch systems, because of the application of strong orthophosphoric acid, would remove the smear layer. The self-etching systems, because no rinsing is there, no washing of the tooth surface is there, they do not remove the smear layer. Smear layer becomes part of the bonding interface. This is the most fundamental difference between self-etch and total etch. If I talk about advantage would be opposite of total etch, that is related to dentine. Okay, why related to dentine advantage? Because there is no collagen shrinkage. We are not rinsing and air drying the substrate, so there is no collagen shrinkage. Secondly, we have seen there is no removal of the smear layer. So once the smear layer is not removed, what would not be there? There would be no dentinal hypersensitivity. So self-etch systems are better whenever we have to use dentine as a bonding substrate. If I talk about disadvantage, all related to enamel. They are the reverse of total etch systems. Why enamel? We know that enamel is more heavily mineralized. So to demineralize the enamel, we need stronger acids like orthophosphoric acid, which are not available with the self-etch systems. So it has poor bond strength. Poor bond strength to enamel. Okay. Example is Clearfill bond. Clearfill bond of your 6th generation self-etch. Then comes the 7th generation. They are the most simplified systems called one-step self-etch. One-step self-etch means the etchant, the primer and the bonding agent all are combined into a single bottle. So they are also called all-in-one systems. Only one bottle is there. We would prepare the tooth structure, take out the fluid from the bottle, rub it onto the tooth surface, and it is called all-in-one system. Okay. Example of 7th generation all-in-one systems is Edper, Prompt LPOP, okay, F bond and G bond. It is Prompt LPOP, F bond and G bond. These are 7th generation systems, all-in-one systems. Their advantages and disadvantages are similar to the 6th generation, that is the two-step self-etch. Advantages related to dentine, disadvantages related to enamel. There is one additional disadvantage that is exclusive to the 7th generation of systems. Okay, they are incompatible with self-cured resins. They are incompatible with self-cured resins. What are self-cured resins? Chemically cured resins. We know that the restorative materials that we use in the contemporary dental practice can be either light cured, which are most frequently used, they can be chemically cured, they can be dual cured. So the chemically cured or the self-cured systems, they cannot be bonded with 7th generation of bonding agents, which is the exclusive disadvantage of self-etching adhesives or the 7th generations. They are also called self-etching adhesives or SEA, another name for the 7th generation. So technically speaking, in the development of the dentine bonding agents, we have these 7 generations. The first 3 generations are obsolete, but for academic reasons you should know them. In the contemporary dental practice, we have the total etch systems, that is the 4th and the 5th generation, and the self-etch systems, which are the 6th and the 7th generations. If we have to compare the bond strength theoretically, then the strongest bond is achieved with the 4th generation of systems, which are called gold standard systems, and the remaining technicalities we have already seen. Now, whenever we use these bonding agents in the clinical situation, we know that the tooth preparation can involve significant amounts of enamel or dentine or both the tissues. We know that whenever we have to bond to the enamel, the choice of agent would be a total etch system. Whenever we have to bond to dentine, the choice of agent would be a self-etch system. But this is technically difficult because we have to use different bonding agents for the different substrates. To simplify these steps, we have something called universal adhesives. Universal adhesives. Okay. These universal adhesives, they can be used in both self-etch and total etch approach. That's why they are called universal. So a single bonding agent is available. If you have got to bond to enamel, you acid etch the surface and bond. If you have to bond to the dentine, you simply apply the bonding agent directly in a self-etch approach. So that's why they are called universal adhesives. They simplify the clinical procedure, and technically they are based on a compound called 10-MDP. The chemical composition of these universal adhesives is 10-MDP, and it bonds ionically with hydroxyapatite of tooth. HA stands for hydroxyapatite of tooth by nanolayering. So this is the mechanism of bonding of these universal adhesives. If we talk about an example, is Futura bond. So what is the advantage of these universal adhesives? They can be used in both the total etch and the self etch approach. So both enamel and dentine are sufficiently bonded for a successful clinical restoration with these bonding agents that are based on 10-MDP. Another advantage of these universal adhesives is that they are capable of bonding with zirconia. Okay, zirconia is a type of ceramic. Today I am not discussing about the zirconia. That may be a topic of one of our future sessions, but you just remember that zirconia can be bonded with a 10-MDP based bonding agent, which are called universal adhesives. So these are the technicalities of your bonding of enamel and dentine as a substrate, starting from the acid etching of enamel and dentine to the development of bonding agents and the different aspects of total etch and self etch systems. So this is all about the fundamental concepts of enamel and dentine adhesion. With this, I end today's session. See you next month in another interesting session based on the subject of conservative and endodontics. Till then, happy reading everyone. Best wishes from my side. Once again, I thank you all for being with me. Good night everyone.